Over centuries, leprosy has always evoked fear, revulsion, and related feelings, and those affected by it have been usually approached by society with a lack of empathy. For a long time, leprosy has posed a monumental physical and psychological challenge for mankind. As we know, till the 1950s, there was a little breakthrough in the terms of knowledge or treatment for leprosy. As a result, the visible deformities caused by it had made leprosy a dreaded disease. The stigma and fear associated with this disease led to social discrimination. Leprosy patients suffered from social boycott at times and were ostracized. Against such a background, Mahatma Gandhi's compassion for patients with leprosy stands out as a towering example of exemplary kindness towards fellow human beings. Gandhiji led by example, often tending to leprosy patients personally, used to attend. In an era which ignorance about the disease held sway, his efforts to eliminate the social stigma suffered by people afflicted by leprosy went a long way in spreading awareness about the disease. In the words of Mahatma Gandhi, I quote, "Leprosy work is not merely medical relief. It is transforming the frustration in life into joy of dedication. Personal ambition into selfless service. If you can change the life of a patient or change his values of life, you can change the village and the country." Unquote. My dear sisters and brothers, I would like to take this opportunity to congratulate the recipients of the International Gandhi Award for Leprosy, Dr. Bhushan Kumar and Sahyog Kust Yajna Trust, Sabarkanta, for the outstanding work they have been doing in this field. Both Dr. Bhushan Kumar and Sahyog Kust Yajna Trust have been working diligently to raise awareness about leprosy, providing care to the affected people, and removing the stigma, which is equally important, if not more, associated with it. Their efforts are truly praiseworthy. My best wishes for their future endeavors. It is heartening to note that Gandhi Memorial Leprosy Foundation has done pioneering work in the field of leprosy eradication. At a time when patients of leprosy were shunned and socially isolated, the foundation stepped forward to lend a helping hand through treatment and rehabilitation. Its endeavors to ensure the integration of leprosy patients into the socially mainstream deserves to be richly commended. Over the years, we have come a long way in our fight against leprosy. We have successfully accomplished levels of leprosy eradication defined as less than 1 case per 10,000 population. National and regional campaigns have also been effective in spreading awareness about the disease. Thanks to the focused strategies worldwide to treat it as a public health problem, the burden of leprosy has reduced significantly in most endemic countries. In 2012-13, India recorded 83,000 leprosy cases with a prevalence of 0.68% per 10,000 population. By April 2012, 33 states and union territories have attained the levels of leprosy elimination of less than 1 case per 10,000 population. Sadly, India still reports the highest number of leprosy cases in the world and accounts for 51% of the new cases detected globally. 2021 figures. We need to intensify our efforts towards early detection of these cases, provide equitable access to appropriate treatment and provide integrated leprosy service in the geographically focused areas with commitment. Awareness in the community is essential to promote early detection. On its part, National Leprosy Eradication Program, NLEP, is paving the way for a leprosy-free India in line with Mahatma Gandhi's vision of leprosy-free India. Several important initiatives have been taken from 2016 onwards to control and eradicate leprosy. I always feel and have the conviction that these initiatives should be taken by the people, by the civil society, along with the government. It should not be left to the government alone, unless the society, well-meaning people like you all, join this campaign. It is not easy to eradicate and also alleviate the sufferings of the people. So I urge upon the people to get themselves involved in this noble task of eradication of leprosy by showing the needed empathy and also lending a helping hand at various levels. This is very much required. The Grama Sabhas, which are mandated by the Constitution, they should include this as part of one of their program. 69% of villages observed the village level meetings in Grama Sabha on Anti-Leprosy Day 2021. We need to improve it further. I had an occasion to go around the country and visit some of these leprosy-affected people in various colonies. The initiative taken by Dr. Ram Naik, former governor. Along with him, I visited certain areas in Mumbai and Chennai and also in my own district, Nellore, to see the condition of the people and the services provided by various institutions, including government-run institutions. A lot of good work is going on, but we need to step it up further. And that's why I call for the social mobilization in support of this great cause. We all know that in India, our philosophy is share and care, Vasudhaika Kutumbakam. Share and care is the core of Indian philosophy. So all of us should devote some time in our life for this service and motivate others and also support the initiative taken by various organizations and also well-meaning people. I once again congratulate Dr. Bhushan Kumar and Sahayog Yajna Trust on receiving the International Gandhi Award for Leprosy. Thank you. Namaskar.